HiQuin for percent. HiQuin cream contains the active ingredient hydroquinone. Hydroquinone is an aromatic organic compound that is a type of phenol, a derivative of benzene, having the chemical formula C6H4O2. Now uses or indication of HiQuin cream. HiQuin cream, which is used for the gradual bleaching of hyperpigmented skin conditions such as chloasma, melasma, freckles, senile lentigines, and other unwanted areas of melanin hyperpigmentation. Now side effects of HiQuin cream. No systemic adverse reactions have been reported. Occasional hypersensitivity, localized contact dermatitis, erythema, stinging, inflammatory reaction. Daily dose of HiQuin cream. Apply a thin film twice daily to the area in need of bleaching or as directed by a physician. HiQuin should be rubbed into the skin well. Makeup can be applied after the treated area has dried. Most discolorations begin to lighten after 4 weeks of treatment, but it may take longer. After desired bleaching, use only as needed to maintain results. After clearing and during maintenance therapy, sun exposure should be avoided on bleached skin by application of a sunscreen or by wearing protective clothing to prevent darkening from recurring. Pregnancy and breastfeeding. In pregnancy, unknown extent of systemic absorption. Unknown if distributed in breast milk. Use caution. Warnings and precautions. 1. Test for skin sensitivity before using by applying the product to an unbroken patch of skin. If no redness or itching occurs within 24 hours, begin treatment. 2. If no bleaching effect is noted after 2 months of treatment, use of hydroquinone products should be discontinued. 3. Lightening effect of hydroquinone may not be noticeable when used on very dark skin. Mechanism of the action of HiQuin cream. Elicits reversible depigmentation of the skin by inhibiting enzymatic oxidation of tyrosine to 3, for dehydroxyphenylalanine DOPA. Also suppresses other melanocyte metabolic processes. Sun exposure reverses effect and cause repigmentation. Do not use HiQuin cream if 1. You are allergic, hypersensitive to hydroquinone or any of the other ingredients of HiQuin cream. 2. Do not use this medicine for sunburn or depilatory usage. 3. If the inflamed skin is on your face, you should not use the cream on your face unless your doctor has told you to use it. Thanks for watching.